Lexi. What brings you in today?
I hurt my knee at basketball practice.
Okay. What's your name?
Ellen.
Alright, Ellen. What year are you?
I'm a first year.
Have you ever hurt your knee before?
Just my ankles.
But nothing too major? Okay. Can you describe to me what happened?
So we were
First of all, can I make you comfortable?
I had to put something under my knee. It really
Like a
hurts.
pillow?
Yeah.
Okay. Is that better?
Yeah.
Okay. Now, tell me what happened.
So it was like warm-ups, and we were doing like power layups. So you like throw the ball at the backboard, and then you jump up, and coach has a pad, and like you rebound it yourself, and then go for the layup. And I was like, I'd like thrown it up, and I jumped, and like it didn't feel right. Like I felt like I couldn't like get any air, and then when I came down, I was just like on the ground.
Okay, so did anyone hit you? Do you think the air dummy affected it?
I mean, I felt it. Like I felt the air dummy like hit me, but not like hard or anything. It already like didn't feel right before I even like touched it.
Okay. And you said you've never had any knee issues before? Okay. Did anyone witness you, or did you notice like how it gave out?
I mean, coach said it just like it just like went out from me.
Okay.
Like, and I felt like there was like something going on in there. Like it's inside my knee that hurts. Like.
Okay. So I saw that you walked in here by yourself, so that's a good sign. How did that feel walking on it?
Terrible.
Okay.
I'd
Yeah.
rather not do that again.
Yeah, you look like it was. You were limping pretty hard. Okay. Did you hear any snapping or popping when you went down?
Like it felt like I heard it and like I don't know, it wasn't like that kind of snap,
Yeah.
but I felt like the best way to describe it is a snap.
Like kind of like a rubber band snapping, like that. Okay.
Yeah.
And you said that felt like it was inside your knee, not outside. So like if I point right here, it's not like I can touch your pain. It's like
It's like
inside.
under there, yeah.
Okay. So you didn't have a collision. You heard a snap. And it's very painful to walk. Do you feel like it's going to give out on you again when you walk?
Yeah, I'm kind of nervous of it.
Okay. Let's go ahead and have you lay back and try to relax as much as you can. And I'm going to go ahead and palpate your knee a little bit, if that's okay with you. And if I do anything that really sets you off, really painful, let me know, okay? But that's not my goal. All right? Does anything hurt on the side here? Okay. Anything hurt over here when I touch it? Down here doesn't hurt at all. And then up over your kneecap, no pain. Not along the border of the kneecap either. Okay, what about up into your quad? How do you go with that? Okay, so I'm going to go to the back a little bit, okay? Do these bother you? Okay. Anything back here? You still feel like I can't really touch the pain?
Yeah.
But it's there?
Yeah.
Okay. Just kind of a constant? Is it throbbing? Radiating?
It's like aching and like it's sharp, but it's aching.
Okay.
I know that doesn't make sense, but it like really hurts, and it feels like my knee is just like rapidly expanding.
Okay.
Like,
Do you feel like it's swelling, like that I can touch, or that it's like inside and there's pressure?
it just feels like a lot of like pressure. Like I don't know if it's actually like noticeable, but it feels like there's just a lot in my knee right now.
Okay. Well then, let's go ahead and do some tests on you right now before it gets too swollen. Okay. So this might not feel most comfortable, but this is the best way that we can get a reading on what's actually going on. Okay. So I'm going to bend you ever so slightly. Go ahead and relax. Let me hold it.
I don't like bending it.
Okay. To get a good read, we're going to have to bend it just a little bit, but we'll go right back to your comfortable position as soon as we can, okay? But I need you to just keep breathing. Okay, right about there. How's that?
It hurts.
Okay. So I'm going to go ahead and pull a little bit on it. I want you to try to stay as relaxed as possible. Go to your happy place. You're on a beach somewhere. Ready?
Yeah, I got this.
Alright, so I'm going to push back on it a little bit now. Same thing, relax, deep breathing, go to your happy place. Ready? Okay, did any of those give you major pain?
Yeah, when you were pulling on it. Other than
Pulling forward?
Yeah.
Okay,
Oh,
so next I'm going to have you kind of wing out at your hip a little bit, just like this. Okay, and I'm going to push a little bit again, okay? Go to your happy place. I want you to keep breathing. Bend a little bit. Okay. So relax.
Didn't feel good when it was straight out, but it wasn't horrible.
Okay. Okay, can you flip over for me just a little bit? Go to your stomach.
Yeah, that hurts.
That hurts?
Yeah,
Okay, what about right like here?
it's better.
Okay. So I'm going to push on a little bit. Now I do want you to tell me if this increases the pain you're experiencing, okay?
A little bit.
A little?
Yeah, it just feels like there's a lot in there.
Yep. Okay, go ahead and flip back over. Sorry, I'm having you move so much. Okay, ready? Go back to your happy place. Deep breath. Doesn't feel good? Does it make it worse because I'm bending it or because of the way I'm moving it?
I think it's because you're bending it.
Okay.
It just doesn't feel stable.
Okay. Good news for you. You're going back to the comfy position. Okay, so I'm going to tell you what each of those tests meant, what I felt when I did the tests, and what that means, okay?
Okay.
Are you comfortable in that position, or do you want to scoot back against the wall? Okay. So the first one I did, we were doing what we call an anterior drawer, just meaning I'm trying to get the two bones in your lower leg to come outwards. If you have healthy ligaments in your knee, then that won't happen. So I will say that I did feel a little bit of elasticity. So once I explain what I'm doing, I'm going to go ahead and do all of those tests on the other knee, just to make sure that what I'm feeling isn't your normal. Does that make sense?
Yeah.
Okay, so then when I push back towards you, that's called the posterior drawer, which just means I'm trying to see if I can get these two bones to move backwards. Like I said, if your ligaments are healthy, then it won't move at all, okay? And then when I pulled your leg out, I was testing the two ligaments on the side. You have a medial and a lateral ligament. And again, I'm just trying to see if I can get any excess movement of the knee, okay? And then the one that I had you on your stomach, and then that last test I did, I was testing the meniscus, which is the cartilage inside of your knee. So it gives you kind of a cushion so when you bend, your bone up here called your femur, and then your tibia, they don't grind against each other. So I'm going to go ahead and do that again on the other leg, and we're going to see what we get, and I'll go ahead and tell you what I think is going on, okay? So go ahead and lay back down. The good thing is you won't have to worry about this one hurting, hopefully, okay? We're going to keep this one as happy as possible while we do this. So let me know if you need to adjust it or anything. Okay, like I said, again we're doing that anterior and then the posterior Then I'm going to have you wing your leg out for me. Good. You're doing great. Awesome. And then I'm not going to go ahead and test the meniscus on this side because that's a test that either you do have some clunking or you don't. Does that make sense?
Yeah.
Okay. So, I will say what I think's going on is I think your medial and your lateral ligaments are fine.
Okay.
They are the same on both knees, and that's what we want. I think your posterior ligament, which is one that's inside your knee, I think that's also fine because it's, again, the same as that knee. What I'm worried about is your anterior ligament, your ACL. You're getting a little more elasticity than I want on this knee compared to that one. But also, good news is I didn't feel any clunking when I was doing your meniscus test. So 1 second, and I will show you what I'm talking about, just in case you are more of a visual learner. Okay, so this would be a good description of your knee, right? So this, we're not even worried about it because it connects your patella to your tibia, and you're not having any pain there. No problems when I palpated it. You're fine. Again, your ligaments on the sides of your knees, those are also fine. You didn't have any pain when I palpated them, and you didn't have any pain or extra movement in your knee when I did your tests. So what I'm most worried about or most concerned about, so here you can kind of tell there's this thick band right here. That's the one in the back, your PCL. That one, again, I told you, felt fine to me. You can kind of see it. It's this one right here. It crosses over and makes an X. That's the one that I'm a little bit concerned about. And we have multiple ways of going about this. Do you have any questions for me this far?
I mean, are ACLs like season-ending problems? Like,
Well, I'm going to give you your different options of treatment.
Okay.
So we have 3
Okay.
that we're going to talk about today. So the first one is don't do anything. Don't do treatment. Don't do rehab. That also means that I could not clear you back to participation. But that means you don't have to get surgery. You don't have to spend a ton of time in here. You just go about living your life as best as you can. Okay? I will say I would not recommend that path because if you're not willing to do at least a minimal treatment, it's going to be very uncomfortable for you. And it also might lead to more long-term injuries or discomfort because if there is a tear in that muscle or in that ligament, it can actually get caught in what we call the joint line. The joint line is right here where your femur and your tibia meet. And that means it can give out on you, it can lock out on you. You'll always feel this constant sensation of being unstable, but that's always a choice. The second one is what we call a coper. So it means that you come in here, we do as much as we can with you. We treat you with ice and compression and hook you up to some of our modalities, and then major rehab. And we try to get you as strong as possible, and then we'll put you in a brace and let you get back to activity. But that'll still take some time, depending on how you heal, because everyone's different. That could take anywhere, just doing the rehab, that could take anywhere from 6 to maybe 12 months, or 12 weeks, but that would be the very long end. But like I said, it's non-invasive. You wouldn't have to have surgery. You would be spending quite a bit of time in here with us. but we would be able to get you back to participation. Now, you might not be as competitive as you were before because, again, you're still not going to have that ACL, which helps with like cutting, which is very big in basketball. Helps with jumping because it keeps your femur and then your tibia and your fibula together, so that it doesn't come out. So this one doesn't come out on you. Does that make sense?
Mm-hmm.
Okay. And then the last course of treatment, which is more of the conventional, what you think about when you think of ACL tears, is a surgical intervention. So what would happen is we would send you to a specialist. They would have an MRI done of your knee, and they would tell you for sure what they think is going on in there. That's a much better diagnostic tool than the test that I did on you today. From there, they'll decide what the best course of action for you, because there's multiple kinds of grafts that you can get, which they'll talk to you more about. And then we would do what we call prehab, so it's the rehabilitation that we do before surgery. We try to get you as strong as possible, so that you have less of a deficit when we're talking about like muscular tone and strength after surgery. So then you would have your procedure, and then come back in here, and we would do everything we can to get you back to or as close to where you were before you injured yourself. Like I said, that's the more normal of the options, but the other two are viable as well. I will tell you though, with the surgery, a lot of the times there are complications down the road. You could have arthritis in 15 to 25 years in your knees. You could also have to have another surgery 15 or 25 years down the road. But like I said, those are your three options. You don't have to make a choice right now. You can go back to your dorm, talk to your parents or your guardians, see what their thoughts are. If you want to go ahead and get a second opinion, that's fine. If you stay within our insurance coverage, then our insurance will help supplement. If you go outside of our coverage, then it would be out of your primary insurance. Does that make sense?
Yeah.
Do you have any questions for me?
I mean, if I like decide that I don't want the surgery,
Mm-hmm.
can I get it later? Like if I try and cope and because it's the first practice in a
Mhm.
year, I could be back by playoffs.
Yeah.
Can I try without the surgery now instead of losing this whole season?
Yeah, that is completely one of your options. If you decide one method, and then you decide actually maybe I should have gone the other way, then we can go ahead and do that. The surgery is the only one you can't really go back on once you have the surgery and you've had it. But if you decide, sports aren't for me, I don't want to do anything at all, I'll just deal with it. And then later down the road you think, no, I do want to, then we can continue to work with you. Same as what you were talking about. If you decide to be a coper, we can go ahead and work with you to the best of our ability, and give you as many resources as we have possible to get you back to competition. But sometimes that doesn't go as we hoped. So at that point, if you decide, yes, I want the surgery, then we can move forward with that. But again, we'll go ahead and treat you today, because really what we're going to do is just trying to calm it down, so we're not doing anything invasive or extensive. So we'll treat you today, let you go back to your dorm, contact your parents or guardians, tell them what happened, tell them what I've told you, and then go from there. If they have any questions, we can always sit down and conference call them together if you don't feel like you are confident in enough in the information I gave you. And I can give them everything I gave you today, as long as I have your permission. So let's go ahead and, first of all, do you have any other questions for me? I will tell you, when you were talking about a season-ending injury, if you have surgery, depending on your surgeon and their opinions, you would be out for closer to like the 6-month mark. But like I said, everyone is different. Everyone heals differently. Every surgeon does things a little bit differently and has different expectations. Okay. So I will go and get you some ice for now. Actually, I'm gonna go ahead and put you in the game ready for 20 minutes if you have time for that, and that's okay with you. The ice will make it feel a lot better. We just won't put very much pressure on it because you've got enough of that going on in here.
Yeah.
And then we'll go ahead and get you like a compression sleeve for the night, just to give you, to encourage the swelling to move back into your body and to give you a little bit of a support. So I'll go get your ice and your game ready, and I will get you that compression sleeve. So no more questions for me?
Nope.
All right. And then we're going to put you on crutches as well, just because you said it was so painful. Don't expect you on the crutches for very long. It's just with the trauma of what has happened, your body, it's very painful for your body to do anything like it used to. And we don't want you to develop any bad habits with your gait and how you walk. Okay? All right. Just hang out there. Is there anything I can do for you to get you comfortable before?
No, I'm fine.
All right. I will be right back.